Hi there, I'm Dr. Eric Sims, and this is Dr. Speak. Today on Dr. Speak, we're going to talk about inflammation because inflammation is a pretty key part of my practice. Anytime a patient has any type of injury or sickness, they're going to be dealing with inflammation. And oftentimes when they come in and they ask me, well, what's causing this? I'll let them know that they're having compression of the nerve. And oftentimes, or pinched nerve. When they have compression of the nerve or a pinched nerve, the inflammation around the joint is what's causing that compression. And they'll ask me, okay, well, what's inflammation and why do I have it? Well, inflammation is your body's natural immune response to any type of injury or sickness, whether it be a bacteria or a virus or some different type of pathogen. And your body uses that to kind of wall off the area, help heal it, and then remove the bad stuff and leave the good stuff. And it kind of goes through a three-step process. The first step of that process is going to be the irritation. So imagine you have a joint that's grinding. The body realizes it's grinding, so it's getting irritated, so it sends an inflammation to try and stop the grinding. It does that by laying down a layer of tissue through the process called granulation, which is the second step of inflammation. Granulation is laying down that thin layer of scar tissue by forming little pockets of tissue. And it does this to help stabilize the area or the injury to the body, and then help to remove any bad stuff when the body goes through a removal process, which is the third stage of inflammation. Now in the second stage of granulation, the easiest way to think about this is when someone has a roast and they've been cooking a long time in a crock pot. When they put that crock pot into the refrigerator, well, the liquid cools, but what comes to the top? Yeah, that layer of grease. So that layer of grease is a lot like the scar tissue that's left behind after the inflammation goes away to help stabilize that area. So that's the process of inflammation, the irritation, granulation, and then the removal. And of course, most times you're going to be leaving behind scar tissue. Why this is important is that scar tissue is oftentimes not going to completely heal the area, but it's helping to try and stabilize. But if left untreated, it can cause greater problems down the line. But we'll talk about that later on in Dr. Speak. Until then, remember your health is a journey. Choose your path.